In this lecture, we will discuss drug use for management of constipation. Constipation is a common problem that is faced by most of the peoples. Constipation is infrequent production of hard stool that requires straining to pass or give a sense of incomplete evacuation. We can also say change in individual bowel habit towards passage of hard stool with difficulty and straining. So what are the causes of constipation? Like decrease in water or decrease in water intake or decrease in fiber content in our diet, local painful condition like anal fissure, piles, because of which the person usually try to avoid the natural cause, which again leads to constipation, lack of muscular exercise or physical activity. Many drugs like muscle relaxant, anticholinergics, calcium channel blockers also causes constipation. Then most of the time constipation can be managed by fiber-rich diet, proper habit time, adequate fluid, and appropriate physical activity. The drugs which are used for management of constipation can be called as purgatives, laxatives, or cathartics. Purgative means these are the drugs which promotes defecation. Laxatives are the drugs that help in evacuation of soft but formed stool. Cathartics are the drugs which help in fluid evacuation. So this shows that it is a strong purgative. So most of the drug act they act on intestinal mucosa to decrease net absorption of water and electrolyte, or our drug may increase the retention of water and electrolyte in the intestinal lumen, or they may stimulate intestinal motility. So our drug may adopt any one of the mechanism to act. So broadly, purgatives can be classified bulk purgatives, osmotic purgatives, stimulant purgatives, stool softener, and lubricants. So bulk purgatives include bran, psyllium, methyl cellulose, spagula, dietary fibers. Osmotic purgatives include saline purgatives, and they are also called saline cathartics. They are strong purgatives, lactulose, glycerin, sorbitol. Stimulant purgative includes bisacodyl, cinna, cascara, castor oil. Then stool softener includes docusades, and lubricant includes liquid paraffin. Then first come to bulk forming agent. Bulk forming agent, when we take the bulk forming agent, they are acted by the colonic bacteria. When they reaches to the large intestine, they are acted by the colonic bacteria, and their effect manifest in 1 to 3 days. They must be taken with the plenty of water. The bulk forming agent includes bran, psyllium, methyl cellulose. We already have seen mechanism of the action, how the bulk forming agent act. So when we take the bulk forming agent, we should take them with a large amount of water. They absorb the water, so increases the bulk. Stretching, due to the increasing of bulk, stretching of the wall of gut will occur, which result in increased peristalsis. So there is an increased passage of intestinal content. So come to dietary fiber. When we take dietary fibers include bran, vegetables, grains, and they contain lignin, cellulose, pectin, hemicellulose. Pectin, hemicellulose, when acted by the bacteria, they causes the there is a fermentation. There is a fermentation of the when there is a fermentation of the pectin and hemicellulose, the short chain fatty acids are formed, which are tropic for the colonic epithelium and also increases the bacterial mass. And the lignin cellulose, which are not fermented, they attract water, increases the stool volume, and thus increases the peristalsis. Bran it is a residue left when flour is prepared. It contains 40% dietary fiber and high lignin content. Psyllium, yeah, or spagula, plantago seeds contain natural colloidal mucilage that forms gelatinous mass. It again, its effect comes in 1 to 3 days. It should not be sort of dry. It should be taken with a large amount of water so that it absorbs water and swell well and increases the bulk. So what are the problem or side effect, we can say side effects with this drugs? Like they have a delayed onset of action, means because as we know, their action is delayed and comes in 1 to 3 days. If we take these drugs with less amount of water, they may absorb the mucosal secretions, and so obstruction incipitated in the intestine or may cause obstruction. They may cause abdominal distension or abdominal pain. Then these drugs are, as we know, they increases the bulk and thus increases the intraluminal pressure. So these drugs are contraindicated in intestinal ulceration, stenosis, and adhesion, as these drugs may causes rupture. Then come to osmotic purgatives. They retain water osmotically and retain and distend the bowel, increasing peristalsis indirectly. So due to their osmotic purgatives, they produce their effect. Drug involves are saline purgatives or saline cathartics, lactulose, glycerin, sorbitol, polyethylene glycol. Then saline cathartics are magnesium sulfate, magnesium hydroxide, sodium sulfate, sodium phosphate, sodium potassium tartrate. They act on small intestine. So the action starts very fast within 3 hours. Magnesium ion also release cholecystokinin, which may aid purgative action of magnesium salt by stimulating fluid and electrolyte secretion. Most of the 5 to 10% of magnesium may absorb and is mainly excreted by the kidney. So if the patient is having renal insufficiency, then magnesium may leads to intake of magnesium may leads to hypermagnesemia and causes cardiovascular, neuromuscular, or neurological depression. So it is contraindicated in patient with renal insufficiency. Then as this is a strong cathartics and may causes the fluid and electrolyte imbalance, so must be contraindicated. Contraindicated in elderly patients. Sodium salts may causes the salt and water retention, so contraindicated in heart failure patients. Then lactulose. Lactulose is metabolized by colonic bacteria into fructose and galactose. These sugars then later fermented into lactic acid and acetic acid that function as a osmotic laxative. Lactic acid and acetic acid also decreases the pH, which decreases the production of ammonia and also decreases the absorption of ammonia by converting into ammonium ion. So it is also useful in hepatic encephalopathy. Adverse side effects. It also have a delayed onset of action, as the site of action is large intestine, and there may be abdominal cramp and flatulence and electrolyte disturbance. And stimulant purgative. They have a direct effect on enterocyte, enteric neuron, and GI smooth muscle. They irritate the mucosa. They irritate the muscle. accumulation of water and electrolyte in the lumen by altering absorptive and secretory activity of the mucosal cell. Their powerful purgatives often produce gripping. The stimulant purgatives are bisacodyl, phenolphthalein, cinna, cascara, castor oil. Phenolphthalein is withdrawn from the market because of carcinogenic tendency. Then come to bisacodyl. Bisacodyl is marketed as enteric-coated and regular tablet and as a suppositories. The drug requires hydrolysis by endogenous esterase in the bowel for activation. There is a possibility of developing an atonic, non-functioning colon. Bisacodyl should not be used for more than 10 consecutive days. Then Cinna cascara aloes. In colon, they are hydrolyzed by bacteria into active form. The anthrol has a direct stimulant action on matrix plexus that increases the smooth muscle contraction and causes defecation. Bowel movement the effect occur in 6 to 12 hours. If we give it rectally, the effect per rectal, the effect obtained within 2 hours. Given usually it is given at night. Brown pigmentation of colon, that is melanosis coli, can occur by the use of this drug. Then castor oil. Castor oil is a fixed oil that is degraded by lipase in upper small intestine into racinoleic acid and glycerin. Racinoleic acid irritates the mucosa, acts on small intestine. It acts on small intestine. It is a strong stimulant purgative. Onset of time, therefore, it is 1 to 3 hours, and therefore it should be taken in the morning. 5 to 20 ml should be taken in morning. Then side effects of stimulant purgatives. They can cause abdominal cramps. Prolonged use may result in dependence and destruction of matrix plexus and may result in atonic colon. There may be a fluid and electrolyte imbalance, hypokalemia, allergic reactions like skin rashes, Figg's drug eruptions, Stevens-Johnson syndrome. Cardiac toxicity, carcinogenicity, pink color urine, they were with phenolphthalein, but again, this drug is withdrawn from the market and not used. Contraindication for the stimulant purgatives, cinna in lactating mother. Castor oil is contraindicated in pregnant mother as reflex contraction of uterus may result in abortion. Then stool softener, they are not absorbed drugs. They soften the feces, thus promoting defecation. May be given orally or rectally. The members include surfactant and lubricants. Surfactants, they decreases the surface tension, increases the penetration of water into feces. Docusate is example. It is given orally or by enema. Is commonly prescribed in hospitalized patients to minimize straining. Lubricants, there's the liquid paraffin. It is indigestible, absorbed to a limited extent. It penetrates and softens the stool, may interfere with the resorption of the water. The problem with liquid paraffin, they are not palatable. Impairs absorption of fat-soluble vitamins. Aspiration of oil droplets in lungs may lead to lipid pneumonitis. Anal seepage of oil leading to irritation and pruritus in eye. Interfere with healing of wounds in anorectal region. Elicitation of foreign body reaction in intestinal mucosa. Then enema. It is a simple and rapid means of relieving acute constipation and for rapid and immediate evacuation of bowel. Tay water enemas, soap water enemas, oil retention enemas are different type of enema that are used. Now, therapeutic indication of purgative. Bedridden patient like myocardial infarction, stroke, fractures, post-operative cases. To avoid straining at stool like hernia, cardiovascular disease, eye surgery, where we want to avoid the straining at stool because may adversely affect the patient. Preparation of bowel for surgery, colonoscopy, abdominal X-ray. In such case, we usually use the saline cathartics or bisacoli. After certain antihelminthics, we again here we use saline cathartics, and in drug poisoning to hasten the removal of drug, again we can use saline purgatives. So thank you for patient listening. Thank you.